So by now you've heard that Oregon is going to be the first state to move to universal health care, and I'm willing to bet that there were three thoughts that crossed your mind as soon as you sort of heard a glimmer of that information. The first is, what? The second is, wow. And the third is, how are we going to pay for it? Lucky for us, there is a team of experts that is working on the answer to this question, and all of their meetings are totally open to the public, and they desperately want to hear from you. That group is called the Finance and Revenue Committee of the Universal Health Plan Governance Board. They have to deliver a sustainable and equitable unified financing strategy for universal healthcare for every Oregon resident. How a universal healthcare system will affect employers, individuals, families, and the general economy of Oregon. The board is responsible for delivering a universal healthcare plan back to the legislature in September 2026. They are not just totally working from scratch. There is the bare bones, or sort of like the framework of a financing model that was recommended by this other group back in 2022. So there is a framework that they're working from, but the realities of the financial world and just how it is in Oregon have changed since 2022. So this summer's publication of a functional universal healthcare plan, including the financing, will be the next step in this iterative process. If you have questions, comments, concerns, critiques about how a financing system for a universal healthcare plan is going to affect you personally, they absolutely want to hear from you. If you are a Medicaid patient and you want to make sure that in this new universal healthcare plan, you'll still have the same access to care that you have on Oregon Health Plan, you should talk to the Finance and Revenue Committee. If you're a small business owner, how is that going to affect you? Are you going to be paying double? Are you like, wait a minute, am I going to be actually stuck paying this insurance premium and also this new universal healthcare system? No. But if you want to talk to them directly, you totally can. Money can be complicated, but in the end, it's just numbers. And these are the groups that are crunching the numbers to make sure that we can get what we need, which is a universal healthcare system for every Oregon resident. All around the world, countries that implement a universal healthcare system see lower costs and better healthcare outcomes. And Oregon is going to follow the model of the working universal healthcare programs around the world to create something that works for every Oregonian that is more functional than our current system. I don't know if you've noticed, it's already really expensive. The May meetings of the Finance and Revenue Committee are on May 6th and on May 20th. See you there.